thanks everybody for joining us here today for another PCD Live, which I'm sure is going to be another fascinating and brilliant one. And we're really, really excited to have Dr. Anne Griffiths and Tami Vance here with us, all the way from Minnesota, I think, if I'm correct.
Yes.
Gosh, so I think you've traveled the furthest virtual distance of all the guests that we've had so far, and we are really excited about this because I know I heard you speak at a conference about a year ago, and it was very inspiring, and I know that it's going to be really interesting to a lot of our PCD community, not just here in the UK, but also across Europe and globally. And I can see we've got lots of people joining us from many different countries today, so that's very exciting. So without further ado, I will ask Abdullah just to stop sharing the slide, and I will let Tami and Dr. Griffiths share their presentation. And it'll be great to hear a little bit about what you do and a little bit about mental health and the topic that you've done so much work in. Over to you. Thank you.
Great. Well, I'm Anne Griffiths. I'm a pediatric pulmonologist and the medical director for the PCD Center here at Children's Minnesota, located in Minneapolis, which is almost like a suburb of Canada. We are northern United States in the middle of the country, just below Canada, frankly. My husband was in Isle of Wight last week, so I'm a little jealous that he got to make it out to the UK, and our goal would be next year. Tami and I are more than happy to come join you all in Europe in person.
We get you. We'll make it happen.
Yeah, sweet. We'll figure that out. Do what we call in the United States a GoFundMe. So we oversee the pediatric care, but that does extend into young adults in their 20s. And we collaborate with adult centers here and are involved in the Primary Ciliary Dyskinesia Foundation here as well in North America. I actually chair the education committee for the PCD Foundation here, and also am a member of the quality and data development for the registry for North America for PCD patients as well. And I've worked with Tami for many years on the care for PCD patients here, and we have a very strong shared passionate interest in terms of mental health and PCD, and how we can really try to bring that to the forefront, as it often takes a back seat in medical providers' offices, but is so integral to the care. So I'll let Tami introduce herself.
Thank you. So I'm Tami Vance. I'm the licensed clinical social worker here at our center. I work with all of our PCD kiddos from birth till they transition to adult care, and I also work with our cystic fibrosis patients as well. And part of my role is kind of, as many of you may know, in some centers, navigating all the resources to manage your care, but then mental health is kind of the key component of my role. So how families are coping and how patients are managing their care. And so Dr. Griffiths and my team quite a bit on supporting families when they come to clinic, and we're just thrilled to be talking about this. I think it's such a meaningful topic, and hope you all get something out of the talk today. So I will get us started with our learning objectives. So we're going to review some of the most common mental health issues related to PCD that we hear about from folks, and then look at tips for building resilience and coping with PCD, and go over wellness and protective factors. And then Dr. Griffiths is going to share how we in our center integrate the mental health care into the PCD care model, and then how to partner with your medical provider and advocate for yourself with more of that care.
And can you all see our screen? Is this showing up on your end? We just want to double check.
No, so I can just see you guys and our participants at the moment. So I don't know if you want to give that another go, maybe.
Yeah. Hang on 1 second. I hit that share button. Yeah.
There we go. I think, yep, we're cooking.
Okay.
It's good. Thank you.
I'm glad we have tech support here. That's not our strong suit. So
mine neither. Trust me. Thank you very much.
Thanks for your patience. Okay, so these are the most common issues that we often hear in PCD that impact mental health. And we know that everyone's PCD journey is so different. And I know you could probably add 10 to 20 more things to this slide, but we wanted to put this on here and give you a second just to kind of gaze across the screen and see what resonates with you, see what speaks to your own experience, see even maybe what's missing But for some, we know that parents, especially parents with kids and even adults, your PCD journey is so variable. So some come to PCD so much later in life, and they're so relieved to kind of finally have an answer to all of their symptoms and everything that's been happening and a plan for care. Where I feel some get this diagnosis right away, and it just evokes fear and worry for your child's future, even guilt at the diagnosis. And so we know that everyone's journey is so very, very different. And it ranges from, managing the insurance and coverage and the financial stress, and more of the things that we maybe push deeper down, the guilt or the fear or the worry, the things that we just don't access as much day to day, but it's still there and has such a tremendous impact and can lead to further anxiety or depression, and things that we carry through.
And sometimes that late diagnosis versus early diagnosis, we see also the burden of care feels different if it's something that's sort of been a part of the care from the get-go, a part of life from day one, as opposed to a routine that is now a very new routine, and a large disruption that is not a part of norm.
Right. Yeah. So what we want to do now, we have a poll that we're hoping we'll be able to launch. And we want to hear what impacts you the most about people. So the last slide was just things that we often hear commonly, but we'd love to know for those of you that are here today, what resonates the most for you. And so hopefully we'll be able to put this poll up here.
Yes. Go ahead. And is Lucy going to put that up?
So Abdullah is going to launch the poll now, but just while he's doing that, is it possible just to, I think maybe just project your voice a little bit more? The audio quality is just a little bit muffly, but seems to be clearer with Anne. So I don't know if it's about the side that the mic is on, or sorry. That would be really helpful.
No. I tend to be louder. I was in theater. I think I just project because I'm short.
Thank you. So the poll is now up. I don't know, can you see it on your screen, Tami?
Yes, I can see it.
It might be helpful if you could read through it for people as well. Thank you.
The question is, what impacts you the most about PCD? And again, if you can't hear me, just raise your hand, Lucy, and have me shout a little more. So some of the things we put on there that we've got you to be able to choose: fear of illness progression, unknown of PCD future, so worry about what that future may be, cannot maintain the treatment routine, drawing attention to my PCD or feeling embarrassed, so more about some of those symptoms you might carry, unable to have the freedom I want in life, guilt or blame of passing this on to my children, policing treatments versus being a supportive parent, can't protect my children from the PCD illness or progression. And then we have other there, which I don't know that you're able to individually type something in, but you can put it in the chat. Yeah.
So if we missed something that you feel like, no, that's crap. That's not what bothers us. That's not what's the biggest hindrance right now. Let us know in the chat. But we really do want to know from you if you would be willing to participate and answer in this poll to give us a sense of what really has been, what's sort of that priority hurdle for you. And we'll just give another second here or two. Abdullah, hopefully you're seeing some responses coming in from participants. Don't be shy, it's anonymous, but it helps us think about how we're chatting today.
Yeah, so we've had 11 out of 16 respondents come back. Yeah.
Okay, that might be all we get, frankly, between all of us.
Feel free to share the results.
Abdullah, if you wouldn't mind.
Yeah, just 1 second.
Okay.
Yeah. Okay. So Tami, what do you think?
Yeah. So fear of illness, unknown of PCD future, cannot maintain the treatment routine are all pretty equally.
The highest, yeah.
Equally the highest, unable to have the freedom I want in life, right? I think some of that is knowing PCD does keep you captive in a lot of ways.
Okay.
And then you maybe have a caregiver at the bottom, or even someone in family planning or
yeah. And I think sometimes that that fear of progression. We see that both in caregivers and in patients.
Yeah.
I think the uncertainty part of what's so hard is that the data is so small and evolving, and we have really skewed our understanding in both extremes about what to expect in terms of progression in the future, which is why those registries are so important as we're learning more and can give patients better information to work with. And the treatment routine is a huge burden. And we talk about that in clinic on a regular basis.
Yep. And we will talk about that later in the presentation as well. Kind of how to manage some of the routine for, adults and kids. If you're a parent and caregiver, it's one of the common stressors and questions that we do get. So thank you. Thank you for completing that. If you have other thoughts in the chat, please feel free to keep adding to that. So knowing kind of how much this impacts our mental health and wellness and just the impact of PCD, I think one of the key things is to first get comfortable with being uncomfortable, right? So we tend to avoid the struggles and the emotions, the feelings that really make us feel out of control. And that avoidance often makes those emotions more intense. And then we're less prepared and we're less able to cope or feel like we can, right? So the more we really allow for these emotions and kind of make space for them, we realize our ability to cope, and the less intense those emotions will be over time. So if you haven't processed your own experience with PCD, what you're going through, whether you're an adult that's in the midst of symptoms of progression or a parent that has a kid with a new diagnosis, I think we have to process that experience. Otherwise, all that unresolved emotion will show up in how we talk to people or how we even share that with our own kids. And I think of a mom that I met with only a couple of weeks ago that has 2 kids with newly diagnosed PCD. And she mentioned to me, I can't talk about PCD without getting emotional, like without tearing up. And that is all that unresolved emotion that's coming up, right? And it's that those triggers, those prickly things that just come up that we feel like, I can't cope with this. I don't know how to handle this. And so what I told her is talking about PCD, to write down all the questions you think you might get from people, from family, from neighbors, write them all down and kind of practice how you would respond and answer them and say it out loud. And that builds our distress tolerance. So the goal is to not make these emotions go away. That's not possible as humans, but is to increase our comfort and recognize our ability to cope with these harder emotions, the things about PCD that I think are harder about and harder to feel. And one strategy, there's many strategies out there and many different therapy modalities, but one strategy that can be a helpful way to cope and a helpful coping skill is cognitive behavioral therapy. And so this is the model of CBT, is what we call that. And some of you may be familiar with this, but it's noticing how your thoughts impact your emotional state that then impacts your behavior or how we respond. And so if we notice a thought, even how we think about PCD or our associations with PCD, if they're more negative, we tend to have more resistance towards PCD. And sometimes negative isn't the most helpful word. Sometimes it's just unhelpful. So thoughts or experiences that are just not helpful to how we can cope. So an example would be a thought that you have like PCD has ruined my life, or no one knows what this is like, or I'm so worried that my child might get sick. Those thoughts will then create feelings like feeling down, feeling more depressed, feeling more hopeless or angry, having some grief and loss that we maybe haven't processed, or just really anxious and worried, that can then lead to behaviors such as refusing treatment or avoiding medical visits or avoiding even social situations where my child may get sick. So that's kind of this triangle in this model. So what we want to do is start to recognize how our thought is impacting that and reframe or challenge that thought. So it's not to make it go from something negative to something positive.
Or insincere, right?
Exactly. Into thinking this is positive. This isn't about rainbows and butterflies. PCD is hard, right? But it's trying to recognize, is this thought helpful? Is it actually benefiting me? Is it helping me cope in a way that is benefiting my life? Is it helping me live the life I want and respond to adversity in the way I want? Or is it keeping me stuck? Is it keeping me in this resistance? kind of framework that's just not allowing me to process and accept this part. And I think this is totally really, really hard when it comes to things that are very much out of our control, such as PCD, right? We have no control over whether or not we have PCD and how the disease might progress. And so when we have no control over a situation, we can either choose resistance against that thing, or we can choose acceptance. And acceptance doesn't mean that we are okay and happy with what's happening. We're just choosing less resistance. And one thing I always remember from kind of the CBT model and even a little DBT, which is dialectic behavioral therapy, is that when we have pain and we add acceptance, we still just have pain. And when we have pain and we add resistance, we have suffering. And so it's a difference in how we can reframe those thoughts and add some acceptance to create this triangle that's really beneficial and helpful. So again, this is just kind of one cognitive strategy, an example to build up these coping skills to manage some of those experiences and feelings that feel very out of control. And part of what we are so passionate about is building resilience. So how do we cope with adversity? PCD isn't going to get easier, right? So we have to build our resilience to cope. And we start with caregivers. We obviously, as pediatric providers, work with the family and the caregivers. And we know that there's a strong correlation between caregivers' mental health and children. And so we really want to support caregivers in seeking your own therapy and support, right? So address your own fears, your own anxiety, your own stress. Especially, I think, as parents, there's a lot of grief and loss when your child has a diagnosis of PCD. It adds a lot of complexity, and then there's a lot of loss expectation, right? There's a lot more to do as a parent when your child has a chronic illness. And it's not what you imagined parenthood to be, right? And so I think we sometimes just have to slow down and allow ourselves to acknowledge that grief and loss, right? And that two things are true. You love your kid, right? You want to take that back, but now this thing happened completely out of my control, and I can also grieve that, right? And we have to grieve that and sit with those emotions and loss in order to kind of shape a new expectation, a new future, a new idea of what this journey of parenthood can look like. So again, it's kind of sitting with those emotions. Those unresolved emotions will continue to come up and kind of trigger you. So we want to make space for them and gain that comfort. Think of therapy as a gym membership for your emotional and mental health. So I know here in the States, we still deal with a lot of stigma and a lot of bias around going to therapy, even though we promote our physical health with such ease. Having a gym membership, going to yoga, and leaving work early to get to the gym. But can we think about that with our mental health in the same way, right? And not waiting for a crisis to feel like I can go to therapy as preventative care, to learn coping skills, to process these hardships in my life, to be able to have that scheduled time where I can sit and bring up all the difficult parts of PCD that I'm just not going to do every day and don't have the time to do at work, or don't want to bother my friends with that all the time. This is your time to do that, right? To really gain that comfort in working through some of those PCD triggers. And then for caregivers, it's learning some research-based parenting strategies and really understanding child and teen development. So we tend to kind of default to whatever our parents did with parenting, and things have changed. We know a lot more. There's a lot more research. There's a lot more evidence on kind of brain development and neuroscience and how that can impact parenting strategies. You don't know this stuff, right, when you have a child. So that's another reason that therapy can be so helpful. And then reparenting, kind of along those lines, like having kids will inevitably trigger all the unresolved things you had from your own childhood, right? So having a place to process some of those issues so it doesn't show up on your kids. So building resilience with PCD, again, these are strategies I think can be helpful for both adults and kids. But these are things that we bring up quite a bit with our families. So just talking about PCD, getting really comfortable with talking about this, especially talking about it with your child. If your child is the one with PCD, or you have a child with PCD, we often want to shield or protect our kids from the hard things, right? But avoiding this tends to create more and more fear. So talking openly about some of the hard parts of PCD actually demystifies them. And it shows your kids and those around you, like, this is okay to talk about. This is normal. This is something that I live with. And it's okay to talk about these things and to answer your kids' questions when they come up, kind of simple, honest answers. And it's okay too if a question comes up and you don't know what to say. Like, ooh, I haven't thought about that myself. I don't know how I'm going to answer that. For kids, just saying, like, I love that you're coming with me or coming to me with this question. What a great question. And I'm going to figure out the answer and I'll come back and we'll talk more about it. So it shows them, like, this is okay for you to come talk to me about this. We're not going to hide from these hard parts of PCD. Along those lines, encourage openness with PCD. So avoiding or hiding part of your PCD tends to foster more shame, embarrassment, a lack of confidence. So the more that you can feel supported in your PCD, I think the better people manage it, right? So especially for kids, like the more their peers know about this or school friends know about this, I feel they're less inclined to skip treatment. They're less inclined to suppress their cough because they're embarrassed. They feel like everyone knows this, it's open, it's part of me, and it just builds up that confidence. And it's hard to do. It's hard to feel as part of that feeling uncomfortable, but building that distress tolerance and helping your kid kind of navigate that and cope with that, right? So everyone has insecurities, everyone has unique ways they have to care for their body. So the more we talk about that, encourage openness with that and really normalize it, I think kids tend to do a little better in managing their care. And then learn emotion regulation and coping skills. So helping kids, and even for yourself, like really validate and acknowledge your emotions, right? So acknowledging and validating emotions allows us to learn the skills to cope and regulate them. So express, not suppress. So suppressing emotions is not regulating emotions, it's just avoiding them. So we want to express so that we can understand how to cope. And name it to tame it is a great strategy. So just naming the emotions really sends signals to our prefrontal cortex, which is in charge of our executive functioning and our regulating, to help calm our nervous system. So just naming, like, I'm really worried about this, or this is really frustrating. Just naming these emotions for yourself allows your nervous system to calm down, and you can then better cope with that feeling and emotion. Take opportunities to master fears. So we see this a lot, I think, with parents that are worried about their kid going to a sleepover or a summer camp, or having to manage their medication and treatments in a new setting where maybe the parents aren't there. Even for adults, like taking a trip or traveling or taking a new job. I think it's easy to just, kind of rescue ourselves from those situations when they're uncomfortable, instead of really tolerating that discomfort and reminding ourselves that these new situations are going to be overwhelming. That doesn't mean they're bad. It means we need new skills, and we need to kind of lean into that discomfort to build that resilience, right? When we avoid new things, especially with children, we're kind of affirming of like, yeah, you should be scared of this, or this might be too embarrassing. Let's not go to the birthday party where you might have to do a treatment, right? Or not go to that sleepover. What we want to do is really just sit with them and validate, this is new, this feels scary, this feels hard, and let's figure out how we can kind of build our skills to kind of cope with this situation.
I think sometimes the message gets confused between, oh, my doctor wants perfection, right? Like my doctor wants me to figure out how to, do my sinus rinse while surfing. And that's not, I think the enemy of good is perfection. Yeah. There are certainly going to be gaps, and that is a part of life, but being able to navigate and challenge some of the times when, it actually isn't a convenience factor. Mm-hmm. It's a stigma factor or an isolation factor or a fear and a trust factor. Trying to kind of walk into that as much as we can, I think, is helpful in terms of confidence.
Mm-hmm. Yeah. And connecting with your, with that part of you, right? So acknowledging is, I'm allowed to feel nervous about something that's new and scary. That doesn't mean I shouldn't do it, right? And play and connect. I mean, obviously for little kids, like they're not going to come home from a hard day or talk about PCD and, or or kind of openly want to talk about some of the hard parts of PCD, but the way they play, can you play with me? It's so regulating. It's how kids get out their stress. It's what really grounds kids and stabilizes them. So really allowing for that playtime and connection, you are building emotion regulation when you do that with your kid. And all of us need connection, right? So finding for those older kids, it's like finding ways that they can connect with other people, even, if they have PCD or just other illnesses where they might be able to have some connection on managing a chronic illness to decrease some of the isolation they might feel. And even for adults, like we all need a person that we can go to at our darkest hour and feel safe and feel like we can be vulnerable and share the hard parts of us. So that does help with that resilience and support factor. So supporting and maintaining treatments. We said we'd get to this. It's one of the most common things that we often hear from families. We know the treatment burden can be tremendous. And so we wanted to give a little bit of strategies and how we try to approach it. But no, there's no magic wand for this. There's no way to make this easy all the time. But we often hear from parents when their kid says, I don't want to do my best. Like, I hate this. I don't want to do it. I refuse to do it. How do we respond? So initially, what we want to usually do as parents or caregivers is jump in with some sort of lecture on how important the best is, why you have to do it, or how you might get sick if you don't do it. Right? We're trying to kind of instantly just fix the situation. And what we need to do is slow down and just allow for those feelings, right? So your kids coming to you, they're showing their feelings to be like, yes, I get it. I would feel that way too. Like, this is hard having to do this every single day. I would feel that way too. Or you're frustrated with all of this. You're allowed to feel that way, right? Or even some days feel easy and simple, and today just must feel harder. It's just a harder day today. You don't want to do it today. You're allowing for those feelings, right? You're validating those feelings and even tolerating those feelings. I know as a parent, you hear that from a kid and you instantly want to just like, oh, you're nervous, you're worried, it's a battle. I don't have time for this. We got to just get to dinner. Like, let's not battle about this right now. Just sit down and do it, right? We don't have time. But really slowing down to tolerate those feelings, right? Because the more we connect with our child on their feelings, or connect with ourselves even on those feelings, it breeds cooperation, right? So when we kind of fast forward and we try to just lecture, I think kids often, their emotions have to get bigger and louder, right? Like, you're not understanding me. You don't get how hard this is. So I often use the example to folks, like if I were to go to my husband, wake up one morning and tell my husband, my partner, like, I just don't want to go to work today. It's a hard day. I just don't want to go. I'm not feeling it. I don't want to go. What am I looking for? Like, what response am I really looking for from my partner, right? Like, if he were to reply to me, well, you have to go. Like, this is your job. Like, you have responsibilities, you have to go. Like, what do you mean? This isn't an option. Like, it's just not an option. Like, we have a mortgage, we have bills, we have health insurance, right? What I want to hear from him is like, I get it. It's one of those days. You're allowed to feel that way. I have felt that way too. It's been a long week. We've been working so hard. I get it. Like, what can we do today to make it easier? Can we do something fun tonight to make this easier, right? I just want to be seen. I want to be heard. I want to be understood. And I know I'm still going to go to work, right? I'm still going to go do the thing I have to do. But now I feel seen and understood. I feel validated. I feel connected. He gets it and he gets me, right? I think that's sometimes all our kids are asking us for, right? To just acknowledge, this feels hard. I get it. You're allowed to feel that way. If I had to do these treatments every single day, I would too, right? And then problem solve. So it's harder today, right? So what can we do to make it a little easier, right? Do you want me to sit with you on the couch and we watch our favorite show together? What do you want to do afterwards that might be fun? You're still maintaining that boundary and that expectation, but you're doing it after you validated and created that connection. So your kid might be in a better place to cooperate. And there's no easy way to do this, right? It feels hard because it is hard. So there's going to be hard days, there's going to be more intense battles, and that's okay. And reminding yourself, it feels hard because it is hard. There's no easy answer to this. You just keep showing up with it. Anything you want to add?
No, I think that covers that.
So when to seek help, therapy is for everyone at any time. That's kind of my key takeaway, okay? And to know that there's apps too. There's apps for the CBT stuff and for other therapy modalities. You feel like you can't get in to see someone in person, but to just know that you don't have to be in a crisis to seek this support. Wellness and protective factors, I'm not going to go through necessarily all of these because I think we all know so many of these things. They're just really the first thing I feel that goes away when we're stressed and overwhelmed or managing illness or managing a hospitalization. But just to remember how important these things are in building that resilience and preventing some of these larger meltdowns or triggers when it comes to PCD and our mental health. So sleep is so important for our regulation. Exercise, we know, reduces anxiety, it reduces depression, helps you sleep better. Time in nature. There's so much evidence that shows even 15 minutes a day decreases stress. And then mindfulness and deep breathing. There's a lot of apps out there now, which is really great. It's making it more accessible to kind of practice some of these mindfulness and deep breathing skills when you're feeling more intense emotions or feeling dysregulated. A healthy diet, we know, impacts mood and energy and alertness. We've talked a lot about the peer connection and fun activities. So the more connected you feel, I think the more important, the more you're willing to cooperate and manage some of the adversity. Social media limits and boundaries.
Hard one.
I mean, this could be like a full day workshop, right? So we're not going to get into too much, but social media has such an impact on kids' mental health and self-esteem. So really, really trying to limit that. And we have more on this, which I think is helpful too for parents and even adults. I always kind of challenge adults to like check in with yourself and see like, what's my mood before and after, or which accounts or groups am I following kind of benefit me, right? Versus take things away from me.
And sometimes we have this within the PCD community specifically, and within other rare disease communities, that on a Facebook group where you can get lots of information.
Mm-hmm.
Sometimes that information is super helpful.
Right.
Sometimes that information is an echo chamber. And a lot of times people are talking about rare complications or I'm struggling with this problem. And we have to remember that it's not, we don't see a lot of people go, well, I'm not, my kid's just rocking it. Or,
Right.
you know, like,
Right.
well, as an adult, I outgrew that really quickly.
Right.
And, you know, or whatever. And so sometimes the sort of gloom doom factor that comes on social media can kind of bring up new fears and new worries as well. So trying to manage that source of information is really tricky.
Yeah. Having good boundaries, right? And it kind of goes back to, is this benefiting me? Is it helpful? Or is it like evoking more fear and anxiety than what's useful, right? Caring and supportive relationships. So for kids, it's so important to know this, that just one stable parent is the single most important factor for a child to develop resilience. So maintaining that connection through all those stages helps build that resilience. And then regular medical and mental health care, to really advocate yourself and seek that regular care for your well-being, and to even work with your PCD provider on how to integrate these conversations and the impact of PCD on your mental health. And so that's our segue into Dr. Griffiths here, who's going to talk more about how we do that at our center and try to integrate this.
So, and this is, I only hope this is helpful in the sense that if you feel you can advocate for this at your center, I encourage you to do so. I think mental health tends to take a little bit of a back seat sometimes when someone is not particularly singularly a mental health specialist, but mental health is a part of what all clinicians are trained to do. It is part of what they're trained to screen for and help do some degree of problem solving and referral. So our center, we really try to plan that at diagnosis and at workup, we're starting to evaluate for what skill sets are there in the early days, because whether or not things are easy breezy right away, or whether or not things are really difficult right away, planning ahead for how to manage stressful times and how to manage really complex emotional concerns, as well as physical concerns, medical trauma, all of those experiences are really hard to navigate if we don't proactively have a framework for how to manage them. So we try very hard to encourage parents, caregivers, patients, spouses to seek therapy early, not because they necessarily have a problem that's going to be fixed at therapy, but to build a framework for how to manage things moving forward. We try to involve and integrate social workers, psychologists, mental health care providers in our team, so that it's a part of our discussion as we're thinking through, okay, well, you know, we're going to need to increase treatments this week, or we're going to need to do something different here or there. And how is that going to impact not only mental health, but also just problem solving, essentially, and keeping that as a holistic approach to care. And then this is the part where I say the enemy of good is perfection. The enemy of good is perfection. Sometimes I think I have, as a PCD physician, I have not always had enough of a litmus test of looking to see what am I prescribing and what is the impact of what I'm prescribing. And whether or not someone tells me they can do something more doesn't necessarily tell me what the impact of putting more treatment burden into their life is going to be. And I think that is an area where over time, I've learned that I need to be more aware of the impact beyond the FEV1, beyond the sputum culture. What is that impact holistically on someone's life? Because if we are pushing somebody over the brink by an additional session of X, Y, or Z therapies, then in the marathon, as opposed to the sprint of whatever this acute care issue is, we may be making trade-offs that we don't want to make. And I think be brave to say that to your clinicians, be open and conversant about, hey, you know, we really have to think about some of the give and take to this. And what, you know, we're doing the best we can. You're doing the best you can. What is the priority of all of the things that we are being asked to do? Because there are times that, you know, sometimes people will say, you know, are you a good mother? Are you a good doctor? Are you a good spouse? You can be all of those things, but probably not all at the same time. So right now you have a huge exam and a huge test, and it is not realistic to expect you to do the same degree of therapies. All right, so we have to think through that together, and vice versa. So I think making room for that is really important, and clinicians need reminders. We need reminders for them. So we do multidisciplinary rounds with all of our care team, with respiratory therapy or physios, as you might call them, with our mental health providers, our geneticists, our nurse practitioners and coordinators, and our research team. We do annual anxiety and depression screening at age 12 and above. And if we have any concerns earlier than that, we will screen younger, usually down to age 6. And we have regular visits with our PCD specific psychologist, social worker crowd to make sure that we are thinking about things from their level of expertise. So this is my slide to remind me, again, partner with your physician, your clinician, your nurse practitioner, whoever is your medical provider. They do have some background in mental health. They may not have all the answers, but they need to know how much this is an issue for you, and they need to know which things are an issue, because I am certain that we all are underestimating as clinicians what our impact is, both therapeutically and in terms of treatment burden. We won't always know that impact unless we hear from you, so that we can have some co-production of care about what is the treatment plan that really is going to work best for you and for your family. So we'll pause. Thank you so much for listening to us across the pond. Questions, we would love to hear them. Chat box if there's anything And also this is an opportunity to share what's worked or what's been challenging as well. And so we'll be quiet here for a moment.
That was absolutely sensational. That was really, really helpful. And I have so many questions written down here already. Thank you both so much. And I remember hearing an amazing talk around mental health, you know, a while ago. And now I just remember quite how amazing it was. So thank you very much for that. And I think what might be useful is if I just, as a slight kind of add-on to this, give a little bit of a kind of overview. So in the UK, we are really fortunate in that we have a commissioned PCD service for diagnostics, for paediatrics and for adults. And those services are working pretty well. And they're working really, really hard. The number of people with PCD being diagnosed in the UK now is just rocketing. So we're getting more and more every month. And those services are having to adapt very quickly to massive patient cohorts that they never thought that they'd have. You know, many of us on this call here are part of those services, whether you have children with PCD or you're an adult with PCD. And part of those services does include psychology. But it is quite limited. So unfortunately, there is a psychology crisis in the UK. I don't know whether it's like this in the States. We just can't get enough psychologists, you know, into those posts. And there's a mental health crisis that we know is a global issue. And I think, so I guess my first question, and then if people want to put stuff in the chat, go ahead. My first question is, we're living in a system where there's limited resources, and so often in the UK when people are referred for psychological input, it's often when they are kind of at crisis point or they're under a lot of pressure. We don't have as much of a preventative culture because of what exists, but there's lots of tools that you've sort of pointed to already that might help people that is not necessarily going directly to a clinical psychologist or maybe not necessarily going to a therapist. Could you perhaps give some other tips about kind of where people might access or ideas for things that might help? And I realised that you did have a slide on sort of things that can contribute to well-being.
Right. I think that's a fabulous question. I think we deal with so many of the same struggles. I think we are in a mental health crisis, especially kind of coming post-pandemic, post-COVID-19, and knowing the impact of mental health. And there's such a limit on the resources available. So we have some of those same struggles here in the States for sure, within our own community. I think we're lucky to kind of have, you know, mental health embedded in our clinic at least, but the referrals to outpatient care are really slim and can have wait lists for months to get into. So again, if you're seeking that care in the state of a crisis and then you get a 5-month wait list, that's how defeated do you feel? And so I think if that option is not available, to connect with a therapist preventatively, so that you can hopefully avoid crises. I think to kind of lower the expectation a tiny bit. I think face-to-face is ideal. That's the ideal, is having that set time where you can go and do that. But I think what's so great about some of the social media and technology is that there's so many different apps now that you can access some of these same skills and some of these same kind of therapy modalities in a very, very accessible, tangible way, just by, you know, being on your phone and joining an app that can give you kind of these weekly suggestions and weekly tips and weekly coping skills. So you can at least start learning some of these things and learning how to incorporate this into your daily life. It's kind of a second-rate thing when you're thinking of going to a psychotherapist or psychologist with that expertise, but it at least can give you something. There's also a lot of great websites and accounts out there now on Instagram and TikTok of people that are really sharing so much more of their expertise to the general public, right? So one of my favorites is Good Inside, which is Dr. Becky. She's a psychologist here in New York, and she shares videos, she shares Instagram posts, she shares workshops on her website. So you can take an anxiety management on her website, an 1.5 hour, workshop that will give you so many tools and strategies and scripts to manage mental health and wellness. So again, it's not the same as sitting with Dr. Becky in person for a 60-minute session, but at least you get some of those, the skills that can help you, right? And start to build on that. And then if you compare that with all those wellness protective factors that we often forget about or dismiss when we're super busy, to try to just increase your wellness, right? Increase your toolbox for skills to manage. But there's so many like that, different apps with meditation that have built-in kind of therapeutic modalities, cognitive behavioral skills. So I mean, if you just went to your apps and typed,
I was going to say
a ton.
There are some there, that is absolutely true. So I know that in the UK, a lot of people use the Calm app, or there's Headspace, and there is, and I believe there's even an NHS sort of CBT, cognitive behavioural therapy resource. So when Katie is back and we've got a little more hands on the deck, we will try and send some of these resources around to people that joined this call. So thank you for answering that one. I have a question here from someone who says they've got a specific question about swimming pools. So their daughter often gets sick after their summer holidays, most likely due to aspiration of pool water. Not swimming would perhaps be better for her physical health, but would impact her mental health. Any suggestions of what to do? That's a really brilliant question. And I think actually, even as a kind of a problem, you know, physical versus mental, that challenge of finding the balance. What would your suggestions be?
Yeah, it's great. This comes up in clinic often when someone is thinking about career choices. We talk about this. In terms of pool, I will say, we talk about Pseudomonas specifically around hot tubs. So I don't know if this is like a pool connected to a hot tub or what, but pseudomonal infections, we often, it really is ubiquitous, but we often talk about hot tubs being breeding ground for Pseudomonas. So it may not be all pools, in other words, it may just be that there's a certain issue with that facility. I think the mental health piece is so huge that we kind of have to think about, this is very much a practice style, I will say. There are some centers who really limit certain activities and others that do not. I think, kind of with the exception of hot tubs, we try really hard not to limit activities, particularly for children. And I think a large part of that, and that sounds really like Pollyanna of us, but which I guess is an American expression for like super optimistic and la-di-da, but we've just
Thank you for the translation.
Thank you. Sorry. I think part of it is when we bubble and isolate, it doesn't allow for that sort of confidence as an adult. So that my biggest concern is if I say, all right, so I'm going to make this easier. Parents will say to me all the time, well, should my child go to daycare? Should they be in a center with a bunch of babies and they're going to get colds and illnesses and whatever? And, and we can't, that reaction of like pulling away early on from sort of normalcy of interactions, I think is a mental health trade-off that we don't want to make for adulthood. And I will say that it's not to say that daycare is right for everyone either. That's not my point. If you can't miss millions of days of work for every time your child has a fever, I get that. I respect that. But in terms of like I want to protect and shelter them, I think it doesn't lead to sort of that well-rounded confidence that we're looking for in an adult, because we want to dismiss her into the world where she's feeling confident and self-capable. And I don't know that, I think, so that's usually what informs most of my decision making. And then some problem solving around, is it that specific pool? Often, maybe it's not really the pool. Maybe it's because we got on airplanes and they're gross, or maybe it's because we're in a new environment. And so we tend to pick up viruses because everyone's traveling around and mingling with people. And so the immunity in the herd is different. Is it that you want to do some other activities? But I think also planning for like, you're going to have an illness if I send my child to summer camp, if I send my child with PCD to the Christmas party, they're likely going to pick up a cold from the well-meaning auntie who thinks she always has allergies, but she's bringing illnesses.
It's really It's very interesting that you say this, and I think this is something that we see a lot where people say, oh, I did everything. I was bleaching the entire kitchen every day, and I was, I didn't let them wear their clothes more than once. I washed their clothes. And there are some kind of hygienic extremes that we go to. And I say we because I've been guilty of it myself. And then you still get ill anyway, or you still catch something and you think all the things that maybe I didn't do. And I think there is that balance, isn't there, between kind of what is a kind of informed choice and, making a decision about, is this a risk that is sensible to take, in the context of things like, for example, the benefit of socializing, going for a sleepover at a friend's, versus not doing anything and being a boy in a bubble. And it's quite interesting, if I could just go to another question in the chat here, which is we have someone saying, are there any resources available for children? And I think this is an important point here, which she feels that her daughter lets PCD define her. She's pleased that she talks about it, but at what point does it become too much?
That's a great question. If you're talking about specific PCD resources for children, it's pretty limited, I would say, but there are quite a few out there for general kind of chronic illness management. But I think one of the key things for that is kids with a chronic illness. I think it's lovely that you are talking openly about it. If she feels comfortable talking about it, well done. I think that's great. But then we have to look at, is that part of her getting more attention? Is more energy put on that part of her than all the other parts, right? So we don't want kids to grow up thinking that the PCD is the loudest, most important part of them, right? We want it to feel like it is one aspect of you, and so is, swimming, like you said, or so is a sport activity, so is art that you're really good at, so is being a good friend, right? So I think it's just noticing how much attention or focus or kind of emotional energy is getting put on her PCD and what's missing, what needs to be built up a little bit more.
What activities to fill. And I think also the age, the development of the child is really important, because if you're talking about a preteen brain or a teenage brain where everyone has to have the same hair and they have to have the same shoes, that phase of life where difference is so exaggerated in the brain of a teenager, they may be processing some of that we also take as, oh my gosh, it's their PCD, but their best friend is really concerned that she's 2 inches shorter than her, and so and that, yes, those are different, but to a teenager it may have more to do with just trying to have that identical sameness twinning with their parent than it really is processing chronic disease. So I think that's the other thing to think about, is like parents think of it as chronic disease. Child may be thinking also it's this sense of sameness and pack that they're seeking through that phase.
And you want to normalize it in line with other things, right? So when she sits down to do her PCD, physio or other medications, do you talk about it with the same kind of weight and energy or intensity as you do, going to brush your teeth or making sure you eat your carrots at dinner, right? It's like all these things are important for your child. All these things are beneficial. So trying to not, really normalize the PCD with all the other healthy things you have to do for your body, so that it doesn't feel like PCD is more important, or the thing that I have to talk about more, the thing that sets me apart is just like, did you, do your nebulizer treatment? Did you brush your teeth? Did you put your pajamas on? All right. Right. It's like, and kind of noticing how much your kid is maybe talking about it in a way that's elevating it more than what they need to be, and then trying to find other ways to build that other stuff up and to understand that piece of development.
What would your recommendation be for maybe parents whose children are perhaps in a bit of a negative cycle about kind of, oh, I've got PCD, and how do you help people break that?
Again, I think it is kind of based on development. So kind of where they're at in their stage of development and age, and how you might approach that and talk about it and what the kid might understand. But it's still on the same lines of really normalizing PCD in line with the other kind of illness or disease or just how we have to care for our bodies, right? Yeah, validating the feelings around that, but then like trying to point out, because I think it can feel so isolated. You can feel like I'm the only one that has to go to the nurse's office for X, Y, and Z, or I'm the only one that has to do this treatment at night before I go to bed. And so pointing out, like, this is something that's unique for your body. This is something that your body needs to be well and healthy. But I know, you know, Mary at work has asthma, right? And she has to have her inhaler every day. And Susie in 3rd grade has diabetes and she has to go to the nurse. And, you know, those are things that they have to do. Or Sally can't eat gluten, right? She has a gluten allergy or a peanut allergy. So there's just really kind of letting them see the difference, letting them see there's so much variability and difference in our bodies and unique ways we have to care for our bodies. So for you, it's PCD. This is what yours is. You know, I have other things that I have to manage and do differently. And when you have those conversations at an early age, really young, you get that, right? I've had kids sit with me and be like, oh yeah, you know, Tommy goes to the nurse's office right before me. He has to do this. And then they see like,
And building that thought process for repetition. Because if it's always, I hate my PCD, and then if you can get in the middle of, I hate my PCD and Tommy is dying. I hate my PCD and Tommy is dying. And just try to build a new spot in that thought, sort of perseverating.
Yeah.
So that it's not the path of least resistance always goes to the next, that you're moving, you just take a detour. You're still frustrated, but you're building in a little bit of a different thought process.
Well, you're building into the ability to cope with this, right? Like this, you're not saying it's not hard or frustrating or irritating, but you can cope with it. Like you are capable of doing these treatments. You're capable of being well, and you're capable of still playing sports and doing all the other things your peers doing, right? So it's kind of trying to create that new pathway in their brain, right? If they're focused on negative pathway, again, it's looking at that CBT model and how can I help my kid? How can I help my child reframe that thought that's really, really unhelpful for them?
And link it to something new.
And kids can, if you even show them that little triangle of thoughts, feelings, behaviors, right? That resistance. I talk about this with kids all the time when it comes to their treatments. Like when you know it's treatment time, you're like, I hate it. They don't like that feeling either. They don't want to be stuck in that, right? And so if you can teach them, like, how can we think about that treatment time? Yeah, it's not my favorite. I don't like it. I can do it. I can cope with it and get it done in 30 minutes and move on with my day. It's just a different way to reframe it and kind of help normalizing that hopefully lessens the negativity over time.
I think that's really, really helpful. And there's a couple of comments in the chat, which I would invite you to read. And someone saying that maybe their daughter picks up on their own anxiety of it as well, which is a very natural thing, I'm sure, but also, you know, probably a big risk, isn't it, in with parents. And I think it must be so hard. I mean, I'm someone with PCD, so I've not got the kind of parental experience, but I know from speaking to a lot of parents that kind of that grieving, that, you know, doing everything to try and keep your kid healthy, and then when they get ill, it's still kind of very stressful. A final question now, and I realize we're overrunning very slightly. So this is a bit on resilience, and I think this goes for everybody. So this is I'm happy to share a personal experience here. I kind of earlier in the year, I felt rubbish about PCD, and I said I used to be really resilient, and I've just lost that like bounce back about it, you know. And I think this is something that we hear a lot, and it's in, I don't know if it's about British culture, but we have this terrible phrase, which is like, keep calm and carry on. And this is a personal opinion, which I'm probably, you know, that keep calm and carry on means that, you know, sometimes you feel like you've got this idea of resilience and being able to like keep going with it all. And so I was very interested in—
We're punishing you. We're telling you should do a better job, right?
Well, exactly. And I was very interested in your discussion about, you know, perfection. The enemy of good is perfection. So could we just just to kind of finish up for the day, could we just settle on having a quick chat about that? That'd be amazing.
So it says, my son was diagnosed 2 years ago. I've gotten tired of the word resilience, having to be resilient, having people tell me how amazingly resilient I am. Resilience is tiring too. We don't have a choice. So learning all these tools and skills will make the resilience less tiring and becoming more the norm. I hadn't thought of how a parent's coping mechanism would influence a child so much. So it's obviously very important that as a parent, I lead by example and see it as one of the most important things that I can help them with in the future. Yes, and enemy of good is perfection, right? So it is hard because I think we talk a lot about build your resilience, and you're like, oh, thanks, I have to add that to the list of my things that I have to do. You
Fit it in
shouldn't have-
between the nebulizers and the physiotherapy, yeah?
Superhumanly resilient. That's not the goal, but just productivity of how we can reframe so that you are in a less anxious state because of how that thought cycle is not breaking.
Right. And all the skills that we're talking about with that validation, you have to be able to do for yourself, right? Like you have to allow yourself to not be okay sometimes.
Yeah.
Allow yourself to not be perfect. Allow yourself to be like, I'm not resilient. I work really, really hard at managing this and acknowledging that and validating that even as a parent, right? There's days that PCD is really hard. So I think sometimes these strategies, you might hear the word like just change your mindset, right?
Yeah.
It's like this is still hard. There's no way to make PCD positive, right? It's just
Except, I'm going to say one thing.
Oh,
There's
okay.
data coming out of the UK that says individuals with PCD are stronger at problem solving as adults.
I believe that.
Because they have had to shuffle so much and multitask and do all of these code switchings and all of these things that like there's a lot coming out in terms of, professionally and career driven sort of realizations in the way that PCD people often enter adulthood with like, I got this. Which I think is really cool.
That's so true. And actually, when I look at our massive PCD family that we have that is always growing, people do some incredible things. So you look at some of the adults and they are filmmakers and they're stylists and they're physicists and they're doctors and they're nurses, there's just this huge array. And that's the professions. They're athletes and they're, incredibly fit. And so I think we have this absolute diversity that you're right. When you get kind of these, there are groups sometimes on social media and you kind of get into the chaotic and the the catastrophizing, which is very easy to do when you're in that situation. But sometimes you're right, that kind of, you forget to look at all the positive kind of role models out there as well. And I think that kind of idea of problem solving, I'm sure, is something that is very true for people with something as complicated as a PCD. Tami and Dr. Griffiths, thank you ever so much. This has been an incredibly helpful talk, insightful talk, and it's just been such a privilege to have you speak to our community today. It really means a lot, and we are very, very grateful to you both. You'll see from the chat as well that feeling is very much shared. So thank you ever so much for coming, and we hope to see you again soon in person on this side of the pond, I'm sure.
Perfect. Thank you so much, everyone.
Thank you. You take care. Thanks ever so much.